I want to say a very big thank you to all my teachers, my senior colleagues that are here. I thank you all for making out time to be with us today. And thank you for your insightful contributions, and particularly the presenters we've had so far. They've really educated us. We've learned a lot about cancers, and going forward, we're going to be operating from a more knowledgeable place. It's such a shame that we do not have the complete presentation from Dr. Kajobola, but I think he gave us a very clear insight into the dream of ASI Ukpo Diagnostic Center. I think they have a comprehensive center that is targeting bridging the cancer care gap in Nigeria. And they are not joking with it. They are not cutting corners. They mean business. And I think before he was locked out by the network, he was telling us about their dream to move into Abuja so that more people can be reached. But I can tell you that even presently, as they operate from Calabar, they are still reaching a very good number of Nigeria. They are highly sought after, and they are giving quality treatment to our cancer patients. So we should applaud them, and we encourage them to keep up the good work that they are doing. And very soon, traveling abroad for the purpose of medical tourism will be history in Nigeria. When we begin to have more centers like ASI Ukpo coming up, when we begin to have more government centers taking interest in cancer care in Nigeria, I believe that going abroad to seek cancer care will be history. Like one of the cancer patients that I was privileged to interact with recently said, she said that going abroad, she has actually experienced Nigerian doctors, and she has experienced doctors abroad, but she has found that the Nigerian doctors are actually more empathetic, and they seem to have lots more to give. That the only thing she has found that has handicapped Nigerian doctors in carrying out their duties is the facilities that they don't have, and also some of the necessary tools that they need to carry out their trade. So I think going forward, the Nigerian government, the policymakers, the stakeholders should all begin to look into the issue of facilities, the tools that the doctor needs to work with to give the best service to their patients. Our doctors are good. They need the support of the system to be able to give their best. All the centers, particularly government centers that are doing great presently in Abuja and in other states, we want to encourage you to not to be discouraged, but keep pushing the bar, because someday soon we are going to get there. There are a lot of individuals that are working on their own, trying to bridge the cancer care gap, and also to upgrade the health system generally. And we see them, we are applauding them, and we are compiling, and we are going to bring, we have a mandate in C-Health to make sure that such providers of such services are connected to the Nigerian patients that may need their services, because we have come to realize that some of the people that go out to seek this care, they go out not because they have the money or they want to go out. They go out because they don't even know where to find or get such care in Nigeria. But we are documenting these places that are offering cutting-edge services in the field of oncology, in interventional radiology, in surgery, in so many other fields of medicine. We are documenting them currently, and we have a duty to connect patients to the facilities that they need locally. That way, we cut down the number of people traveling abroad for the purpose of medical tourism. And we hope that gradually, going forward, we'll be able to reverse the trend of medical tourism in Nigeria. As a group, or as a non-governmental organization that CHELP is, CHELP also has done a number of things, and CHELP also is looking at doing a number of things going forward. We have some products or programs that we've been doing to impact our world. Our mandate is to impact the Nigerian patients positively wherever we find ourselves and in whatever field. And so one of the programs that we have in place is what we call the Rescue Naija project. The Rescue Naija project is basically an emergency, it's an emergency kind of service where we try to teach or educate the lay public on what they need to know concerning basic emergencies. You agree with me that there is a dearth of knowledge among the Nigerian populace as to what to do when an emergency occurs around them. A number of years ago, I think it was around 2020, the video circulated widely when a woman who was seen in a reunion, I think an old school reunion forum, she was dancing and suddenly she fell down. And so many people were milling around her, and of this great number milling around her, nobody knew what to do. And we found that so saddening that a vast majority of Nigerians actually do not know what to do in an emergency setting. So Rescue Naija is tailored towards educating the lay public and equipping them with basic knowledge of first aid, basic knowledge of cardiopulmonary resuscitation, just basic things you need to do to keep your patient, to keep the patient alive till expert help arrives, to keep the patient alive until you get the patient to the nearest hospital that is qualified to attend to such a patient. So basically that is what we target in Rescue Naija, and gradually we're making impact. And the next phase of the Rescue Naija project will be the phase whereby we are able to get in ambulances. We may start with 1, 2 at the beginning, but the whole purpose of the Rescue Naija ambulances will be to also assist the government in the good work they are doing already, particularly the Federal Road Safety Corps. They are doing a great job bringing our people to the hospital, particularly following accidents and other things. So we're going to be running an ambulance service to support that aspect of work, and it's going to be basically free. As we unroll the project, as we get to have clarity on the project, the Nigerian people will get to know more about it, and hopefully we'll be able to work hand in hand. The work is enormous. No one person can do it, but when we all join hands together, collectively we can achieve that Nigeria of our dream. Also, another area that we are working on in CHELP is the Heroes of Health Awards. It debuted last year during our last health summit. We realized that this brain drain that is occurring in Nigeria, most of the time people take the decision to leave this country because of some level of dissatisfaction. Sometimes they feel unappreciated. When you go to the corridors of the average health facility in Nigeria, you will see doctors, nurses, medical laboratory scientists, the health assistants, the record people. People are working tirelessly. They are giving of themselves to the system, but many of those people are unrecognized. Many of them are unrecognized. They are unrecognized, they are unappreciated. They work in the worst conditions possible, the worst conditions imaginable. Sometimes you begin to feel drained and you suffer burnout. And when you begin to suffer burnout, it is not a recipe for giving your best. And so we realize that when people have gotten to that point, they begin to seek the way out. And that is why it's not surprising that we see a lot of our people going to queue at Saudi Arabia embassies, the United Kingdom embassies, trying to get out of this country. In our own small way in CHealth, we introduced the Heroes of Health Awards so that we can recognize some of these people. It may not be much now, but we just want to tell them, like, look, we care about the service you put out there. We appreciate the service that you render. And we believe that as we grow with these Heroes of Health Awards, more people will feel appreciated and they'll be motivated to give more of themselves. The humanitarian work most people say is a thankless job, but we want to thank people. We want to make them feel more appreciated. We want them to desire to give more of themselves as they carry out the services that they are called to do. And of course, the Health Summit, it has come to stay. This is the 5th edition. And with each passing year, we grow, we improve, and going forward, we know that we are going to be innovating, and we are going to bringing more impactful things to the table. Then, of course, in CHealth, one other area that we are big on is research. We are big on research because data moves. Data drives progress. A community without data is a community that cannot plan. And when you cannot plan, you cannot grow. And so at CHealth, we have taken it upon ourselves that we are going to drive research. By driving research, we are going to try to drive the growth of the health system. And by driving the growth of the health system, we are going to drive the growth of Nigeria as a whole. We don't want to look at the big picture. We just want to start small. We want to bring the change that we desire in Nigeria, one research at a time. And I'm happy to say that in that regard, the CHealth has established the Journal of Medical and Basic Scientific Research, and it is currently doing pretty well. It is ably led by the erudite professor, Professor Ahmed Mohamed, and he's doing a great job. And we are looking forward to having researches that convert, not just researches that are on paper, that don't translate to anything, that don't add to the growth of the community. But this time around, we are pushing for excellence. Journal of Medical and Basic Scientific Research is pushing for excellence. It's going to grow researchers as we go forward that are going to turn the tide of events in medicine. So we're looking at researches that eventually convert, researches that are patentable. I was listening to the former, that's the immediate past chaired executive secretary of TEDFund some time back. And he said that there is funding for research, but the the challenges and the frustrations that he has is because most of the researches that are being presented to him to fund are researches that are not patentable, researches that they don't have value. They cannot bring about innovation. And we need innovative researches to grow the system. So he said, if you come with your innovative researches that can actually bring a change in the community, bring a change in patient treatment, bring a change in the way we take care of our patients, that the TED Fund is more than happy to fund such researches. So one of our mandates in Journal of Medical and Basic Research will be to push for quality researchers that are able to bring up on board patentable researches. And of course, in the area of cancer treatment support, we've done some work. We've tried to connect patients that may need some form of expert care. We've tried to connect them to the right place for them to get that help. Sometimes we connect patients to some organizations that are able to fund part of their treatment. We've been able to do that we've been able to connect, I think, 1 or 2 patients to Medicaid in the past, and they've supported a part of their treatment. But while mentioning this, I must quickly say something. I realize that sometimes as Nigerians, we are our own problem. Because I'll give a particular example. There was a young lady who was introduced to me for the purpose of our organization helping with cancer funding. At the time, we were unable to support her. So what we did was to connect her to Medicaid, and then graciously, Medicaid was able to donate a certain amount towards her cancer care. I think she was due for radiotherapy at the time. She was asked to go to Sokoto, but we were able to navigate her back to Abuja so that she could have her treatment in National Hospital at that time. And Medicaid was able to provide the funding. But to my shock, because what we didn't touch the fund, and we also tried to raise funds for her on social media, but we didn't touch the fund. We made sure all her funds went into her account, but we requested that CHEP gets email of every donation that was made into her account. So we're keeping tabs. But to my surprise, when the money came and there was enough money to take care of that treatment, the brother, the other relatives, they started withdrawing. They decided that they don't want the radiotherapy anymore. I mean, I think it was maybe brachytherapy or something. I can't remember the exact treatment now. But they started withdrawing. They started saying that they wanted traditional treatment instead, and that the money would be useful to take care of the children, to take care of, I was so shocked. Why did you bother us to look for money for you? And then at this critical stage, when we have found the money, we have already been able to navigate you into a closer health facility that was ready to undergo, give you the necessary treatment. And then you start withdrawing and telling us that you prefer traditional treatment, and you want to channel the money to some other areas of need. So such behaviors, they discourage those of us that have decided to put ourselves in the gap to help such patients. Nonetheless, there are a number of other patients that are good and are worthy of being supported. So I want to encourage us that if we find such people, we should still continue to help and support them. Then, of course, one area that we are big on in C-Help is we love to carry out, every once in a while, we love to carry out free clinics in rural communities, because when we go to rural communities, we are able to reach indigent people. and they really appreciate the little that we are able to provide. So far, we've not had surgeries for people, for indigent people. We've not had free surgeries. We don't have the capacity for that yet, but I see that a number of other sister organizations are doing that. Particularly, I want to shout out to Dr. Waziri, the Waziris. I think they've been doing that, and some other people too, they've been doing that. I think it's great. And we don't have the capacity for that yet, but we are looking into it. Maybe in the nearest future, if we have the right support and right platform, we might also go into that. Then, of course, the last but not the least is the area of orthopedic solutions. Yes, the area of orthopedic solutions. Yeah, and particularly of great interest to us right now, we are looking at the amputees. Most of the time, we tell people amputation is not the end of an individual's life. Instead, we encourage people to look at amputation as the surgery that gives you back your life. It gives you back your life. But the only way you can convince an amputee that you're giving him back his life is when you also try, after the surgery, to bring him to as near normal as possible, or to almost to the condition that he was before he got amputated. And what am I saying? I'm saying that it's not enough to provide an amputation, but you must make sure you try your best to get your patient fitted for a prosthetic foot or a prosthetic limb. It's quite expensive. Many of them cannot afford it, but so far we've tried our best at C-Help to connect a few persons to organizations that are able to provide limb. Presently, as we speak, we're trying to connect a 15-year-old boy to an organization that is providing free prosthetic limbs. I'll not mention their name now, so that because we've not reached the final stage, they've passed the questionnaire stage. They've reached out to us, to me as his physician. They've reached out to his parents. They are working on the paperwork. They've taken his measurements, the negative test and all. So they are able to provide prosthesis for such people. Then the second aspect of our drive for prosthetic limb as a form of orthopedic solutions in C-Help is that we are researching the possibility of providing less expensive prosthesis from recycled waste materials, that's the plastic. And it's not a novel idea, and it's not our primary idea.
Nice to meet you. What's the name, sir?
It has been done in an African country successfully, and we are looking into the possibility of doing that
as a big name.
C-Help. So right now,
my battery wants to go. Guys, how much is my money?
We are still in the process of researching the idea, and I assure you that when we are able to roll it, able to get it off the ground, definitely be a part of that dream. Our dream is for every amputee to be able to walk. And in the past, we have also worked with Fit. What's the name now? Fit of Grace. I think we've worked with them. We've created awareness. And
you want your posting to be postponed.
We've done a number of
How about your girl don't come out?
campaigns with
Or
them.
you've not seen it?
So we encourage everyone who
But it doesn't go out.
has had an amputation and is feeling
Anyhow.
less
The 12 don't know.
than
They go out.
he truly is.
So shall I not
We
forget
encourage such
something?
people to
Guys,
see
I
us
left pounds and
for
dollars.
counseling, for
Guys,
psychosocial support,
yes,
and where possible, we can connect them to the right source to be able to get their prosthetic limb. So I think I will leave it for now. And if there are questions, if there are contributions, my co-host will be able to handle them while we check in on the next presenter to take the podium. Thank you very much. I really appreciate your time with us here today.